presumably everybody had a wonderful evening. I know there's 6 people who probably spent all night figuring out how to use iPad 2s, and maybe were Skyping or sending video images to people and trying out those cameras, so enjoy them. Well, we've got another exciting morning with 3 key speakers and important topics, and based on the buzz yesterday during the reception, everybody got a lot out of yesterday, both the keynotes and the breakouts. And as I look at the attendance list, more than ever, we've got teams coming from organizations with 2, 3, 4, 5, and 6 leaders from an individual organization, and I think that was the vision that we had, and it's taken a while for that to evolve, but you know that when you go back home and you've got 3 or 4 colleagues who've been here and you've been able to cover 2 or 3 of the breakout sessions, you can really have that interchange and dialogue and think about what the take-homes are back for your organization. So before we get started with the speaker, I want to share some news and some important information. The ICQV board met last night, and it's something that we've been debating really since last year's meeting. The success of the annual meeting and the growth of the organization has started to outstrip our infrastructure. It takes a lot to put on a conference like this and to create other content. So we've been in dialogue and thought about what the future of the organization is, and last night we approved a proposal that's already been approved by the American Medical Group Association Board and the Medical Group Foundation Board, and in essence we're going to hand over the charge of ICQV to the AMGA, and the AMGA is going to create a collaborative for clinical integration and value and continue to sponsor educational meetings targeted to the specific needs of clinical integration and value, and focus on the types of individuals and organizations that have attended. For the member organizations of ICQV, and if those who have paid close attention, we didn't collect dues for 2011, anticipating that this might happen. But for the member organizations of ICQV who are not members of AMGA, and there's 8 or 9 of you, the AMGA will grant you 1 year's free membership starting July 1 through June 30th of 2012, and also will invite you to participate in any or all of their leadership councils at no charge for the first year, as they want to have you taste it and expect that you'll want to renew membership. And let me just share some background for those of you who aren't that familiar with AMGA. But AMGA represents medical groups and organized systems of care, which includes IPAs and PHOs. Today, there's more than 113,000 physician practices and AMGA member organizations that serve about 110 million patients in 49 states. The AMGA provides a comprehensive package of benefits, including political advocacy, educational and networking programs, publications, benchmarking, data services, and financial and operations assistance. Their mission is to improve health care for patients by supporting multi-specialty medical groups and other organized systems of care. AMG values, and there's a lot of overlap with ICQV mission and values. AMGA has 6 major values that drive our work and contribute to our culture. 1, physician leadership. 2, fully integrated, efficient, patient-centered care. 3, teamwork across specialties. 4, continuous improvement of patient care systems. 5, total coordinated care through the use of interoperable electronic health records, dedicated care managers or care coordinators, evidence-based care guidelines, and systematic monitoring of quality and efficiency. and 6, transparency and accountability for clinical care outcomes at the group level with that. So the ICQV board felt that there really was like a hand-in-glove fit between the purpose of ICQV and the mission and values of AMGA and the AMGA leadership, both senior staff and their board has embraced and welcomed and committed to moving forward. The ICQV board will be the initial steering committee for the collaborative on clinical quality and value to assure continuity and similar programming. For those who aren't real familiar, the AMGA does 2 big national meetings. They do a September meeting on quality, and they do their national annual meeting usually in the spring. I think next year it's early March in San Diego, and there typically is a day pre-meeting focused on quality and the collaboratives. And they will, I'm sure, be in touch with all of you as we'll transfer our registration list and email addresses. The ICQV website is still up and running, and we'll post any updates there as well. During the break or over lunch, for those who are staying for lunch, be happy to answer specific questions, and I'm sure any of the other board members could do the same with that. But I think it's an exciting time, nothing that was in the back of any of our minds 6 years ago when we had the first meeting that this would help take us to a national level. But one of the things that struck me, one of the speakers said to me Wednesday night when we were having dinner that when he got invited to speak at the conference, he thought this was a local Chicago/Illinois meeting, and it seemed like a nice topic, and he agreed to come. He went on the website and he looked at some of the past material, and it struck him that there were people coming from all over the country, and he wondered why didn't he know about it. And that's one of the challenges in a startup, and AMGA will certainly make sure that all organized physician groups across the country are aware of these activities and help grow and further the vision and the mission. And the tie-in to the American Medical Group Foundation is that the assets in ICQV will be donated to that foundation, both ICQV and the AMG Foundation, or 501(c)(3) not-for-profit organizations, and they'll be in restricted fund to support clinical integration and value education. So we know that there'll be a legacy and things will move on. So that was the big update from the board meeting last night. I think everything else related to the conference seems on a par with prior years. We will email out an evaluation form later this afternoon, so you'll get it as you travel home, and would really value everybody's feedback, you know, the usual questions about logistics, et cetera, but also a chance to provide insights into what are things that should be focused on, speakers that you want to have back, or speakers that you're aware of that weren't here that you think would be valuable for everybody with an interest in this.